And as we count down to Christmas, another story we're talking about today, and maybe this affects you and your family, it's about whether you'll be able to see your loved ones in care homes this Christmas, because for some care home residents in Sussex, they face a bleak Christmas away from their families.
Time is so precious. We grasp every moment that we possibly can get. Who knows, this could be my dad's last Christmas. It's just devastating.
Relatives telling us some care homes are implementing draconian rules limiting visits to their loved ones over the crucial Christmas period. New government guidance has come in response to the surge of Omicron cases, restricting visitors to 3 per resident. But according to some families, this simply isn't happening. While some are following the guidance, other homes are introducing time limits or even banning all visitors. Joanne Jannaway is from Chichester. Her dad, who has dementia, is in a care home in West Sussex. She's been told only her mum, who is his essential caregiver, can visit this Christmas.
It's devastating. Last year, everybody was in the same boat. We didn't know what was going on. It was all new. And, what we had to do guided by the government with, waiting for jabs to be coming out and things like that. To be told for a second year running, with all the changes that we've had with jabs and vaccinations, all that sort of thing, to then be told again when I have spent every single Christmas with my dad. I'm 37 years old and I've never not spent Christmas with my mum and dad. And the same as my children. My children are 15 and 11 and up till last year have also spent every single Christmas with my mum and dad. So to be told again, words don't describe how it feels. It's infuriating, it's heartbreaking, it just has a detrimental effect on us as a family and also my dad. It's just heartbreaking that we can't see him.
And Joanne says denying residents the right to see their families can have devastating consequences.
My dad deteriorated so much in the first lockdown. When my dad went in the home in February 2020, and then of course we had lockdown in March 2020. And in the space of 4 months of having no family contact and interaction, he's lost all speech, he's double incontinent. So time is so precious, especially with dementia patients and Alzheimer's. We never know what's round the corner. Every stage of dementia can hit them with an instant. So we, as family members, we grasp every moment that we possibly can get. And who knows, this could be my dad's last Christmas. That's why we clasp at every little bit that we can to make those memories, because dementia is already stripping our family members of their personality and their memories, that we thrive to keep that alive in some way or another. It's just devastating. It really is.
Joanne Jannaway there. Now, campaign groups have condemned what they call a postcode lottery, where residents are at the whim of the care home manager. And we'll have more on this after 7 o'clock. I'll be talking to Kate Meacock from West Hoathly and how it's been like.
See him.
Joanne Jannaway there from Chichester. Joining me now is Kate Meacock from West Hoathly near East Grinstead, whose mother is in a care home outside of Sussex. Hi, Kate. Morning to you.
Good morning, Danny. How are you?
I'm well this morning, thank you. Season's greetings to you, but tell me about seeing Mum this Christmas. Is that possible?
I'm hoping it's possible. We've been asked to let the care home know when we want to go. They are having a limited number of, not limited number of visitors on Christmas Day, but they want to make it fair for everyone. But I mean, it's very frustrating. Visiting at Christmas should be no different to any other day, if it's Christmas, Easter, or Tuesday. Frankly, in my opinion, it shouldn't make any difference.
Do you think things have changed with the rise of Omicron, because we don't quite know where we are with that yet, and how infectious it is, and the damage it could do if it got into a care home, for instance?
It may be, and that could be causing this. But Omicron, the restrictions for Christmas were coming out before the new variant had been made sort of apparent. The last time I spoke to Alison actually on your show, we were talking about essential caregiver, and the next day my mum's home went into lockdown because of an outbreak. And as an essential caregiver, I should have still been able to go in and see her, but we were all banned, and it was heartbreaking. We, as families, we haven't seen our loved ones properly for 16, 20 months, and to go through this for a second Christmas running is really really hard. And for someone like Joanne, I just feel for her desperately.
Sure. And what about your mum? What does she say when you talk to her about all of this?
The problem, my mum's dementia is so advanced now that she's completely non-communicative. So for me to have, over the last 4 months, I've been able to reconnect with her slightly. Bring her out of her shell again. She had completely withdrawn, but it can take me 20 minutes to get through to her in a way.
Yes.
And it's I get the joy now. She does. I saw her yesterday, and she was laughing and whatever. But it's really hard. It really is hard. And so this could be her last Christmas. I didn't see her last Christmas. I had a 2-minute Skype call with her, and she can't concentrate on Skype. She can't connect through Skype, and so you just need that personal contact. And we've care home residents are generally now all triple jabbed. We've got testing. We've got infection control measures, PPE. There shouldn't be a reason for not allowing families in, especially 3 nominated visitors and the essential caregiver. The guidance is really clear, and it should be followed.
You no doubt spoken to the home as well, and what have they said back to you?
They have asked that. Actually, my father's moved into respite care there as well yesterday, so I've now got both parents in one place. They have said, to basically make an appointment, and hopefully they can accommodate everyone, and let everyone have sort of some time, with their loved ones in their rooms. You can't sit. Normally they would invite families in, you'd sit and you'd eat together and whatever. And I understand that it's a much more communal living, and I know that would be very difficult, or if not impossible, for homes to accommodate. But I think they should be allowing families in for the Christmas. It's just not fair.
Okay, Kate. Listen, obviously a very difficult time for you, so we're thinking of you. I wish you well. Stay well, so you can stay well for them, and wish you all the best.
All right, thanks, Danny.
Thanks, Kate. Nice to speak to you. Kate Meacock there in West Hoathly. Speak to Diane Mayhew, who's co-founder of the campaign group Rights for Residents. Hi, Diane.
Hi, Danny. Thank you for covering this really important issue.
It's a difficult one because you can probably see both sides of this argument, but what would you say about restrictions on relatives going to see when there are rules in place, there is guidance from the government?
Well, the government has based this guidance, Danny, around Omicron. So I think, when we were contacted by the media about being restricted to 3 named visitors and an ECG, for many care providers who weren't following the guidance in the first place, this would have had to have been a massive leap forward. But I think, we need to get this into perspective. We've got some care providers who still aren't allowing essential caregiver. And when we talk about Christmas visits, I heard your previous caller, Tony, saying, they can't open the doors and let, visitors flood in. But we're not talking about getting together in a large family gathering in a communal area. To put it into perspective, we're talking about, communicating with relatives. Some relatives will be taking the loved one out. Some people live too far away to visit. The visits can be spread over the festive period. So it's about communicating with relatives and deciding how best to facilitate those visits. And, when myself and my partner were able to go in and see my partner's mum before she sadly passed away, we have been triply vaccinated. We took a temperature check, which was on the wall in the entrance of the care home. We donned our own PPE. We took our test and registered it online, and we went directly into the room of our loved one. So I'm not clear, apart from opening the door, what the staff have actually got to do to put themselves at risk from from these visits, it doesn't make sense, particularly when there are no restrictions in the community other than wearing a mask in public.
Yeah, because Tony was saying earlier about, wanting to keep his staff safe as well so they can continue to turn up to work, because if they have to go home and isolate, that's fewer staff to look after our loved ones. But, it's a time when we do want to go in. So, Diane, thank you very much for chatting to us at Rights for Residents there, co-founder of that campaign, Diane Mayhew. Vanessa Nickerson is from Brighton. Vanessa, please tell us about your situation. Good morning.
Hi, good morning, Danny. Good morning, Diane. Thank you for that. Yeah. So my brother David, he's 48 years old and he is in a care home in Hove. He has MS. So our situation's a little bit different. He basically has been in lockdown, what they announced since the 10th of December. Immediately I took legal advice where they pointed me to the guidance from the government, and soon after that I established with the director of the care home that he is in fact allowed out on outings. He is also allowed in the garden because he's triple vaccinated, he's testing negative. There had been a case of COVID in the home. Now, I got a text yesterday morning from him going, "Help me, please." And what they'd said is that if he goes on any outing, they've just suddenly changed this, that he would then be confined to his room for 14 days. So confined to his room and not allowed even out in the garden. On top of that, they failed to tell us that he's allowed any visitors. We didn't even know that. So our rights and his rights have just been completely ignored.
And do you think care homes are taking this kind of action, Vanessa, because they don't know yet, how virulent Omicron is going to be, what would happen if it got loose in a care home? Are they just being ultra cautious, do you think, or not?
Well, I think they are being ultra cautious. I think they're doing a blanket risk policy. And, I've looked it up, and the emphasis must be in the law that the risk appraisal is not striving to avoid all risk. They have to take the individual patient's needs into account and look at each case individually.
Yes, they've got individual cases to look at, but also the group, the cohort of residents as well. They have that broader view as well, don't they?
But it's completely illogical. I mean, all the residents are in their room. They haven't mingled for over 10 days.
Yes.
The staff are coming in and out. Of course, they're all rigorously tested. But what difference? So that the manager of the care home said to me that he wouldn't be able to go in the garden, even if he was negative, because he couldn't run the risk of David being pushed down a corridor. Now, that's completely illogical to me. And also the fact that he's expected to be in a care home with a case of COVID where he has no access to fresh air or exercise. Yeah. I mean, even under the strictest lockdown, every individual had the right to 1 hour's exercise and fresh air.
Very difficult for you, Vanessa, and the family. Do you think you'll see him in the next few days? What do you think is going to happen?
Well, I don't really know. I mean, it's gone a bit silent now at the care home. I mean, we will see him, we will take him out, and we will continue to fight for his rights, because we see this as completely inhumane, immoral. I think it's a complete disgrace, and above all that, it's illegal what they're doing, and they are not keeping us up to date with our rights and his rights, and he's terrified.
Okay, Vanessa, you're in a very difficult situation. I appreciate that, and I wish you and your brother all the best. Vanessa Nickerson there in Brighton. Thank you. It's 8:30 on BBC Radio